Your doctor may be overtreating you. Think the same blood test numbers that worried you at 50 should still worry you at 70? Think again. Medical science has discovered that many normal ranges were designed for younger adults, not seniors. And following these outdated targets after 65 could be doing you more harm than good. In fact, 26% to 40% of seniors are being overtreated based on blood test results that may be perfectly normal for their age. This overtreatment is sending thousands to the emergency room with dangerous side effects, medication interactions, and complications that could have been avoided. In this video, we're revealing 5 blood test results that mean something completely different after 65, ranked from most commonly misinterpreted to the one that could literally be putting your life at risk right now. Each one is backed by the latest medical research that most doctors haven't caught up with yet. Stick around until the end, because blood test number 1 is being used to justify treatments that increase your risk of falls, fractures, and even death by 25% in seniors. But when interpreted correctly for your age, these same numbers could be protecting you. But before we dive in, let us know in the comments, what's the blood test result that worries you most? We're reading and replying to every single comment. Now, let's start with a blood test result that's causing unnecessary anxiety in millions of seniors. Number 5. PSA levels. Prostate-specific antigen. PSA testing after 70 has become one of the most controversial blood tests in senior care, and for good reason. While your doctor might still be pushing for annual PSA screenings, major medical organizations are now questioning whether this test does more harm than good for most men over 70. The U.S. Preventive Services Task Force explicitly recommends against PSA screening for men 70 and older. Why? Because after decades of research, we've learned that most prostate cancers found in elderly men grow so slowly that they'll never cause symptoms or threaten life. In fact, studies show that 80% of men over 80 have slow-growing prostate cancer that will never harm them. Here's what makes PSA interpretation different after 70. A PSA level that would trigger immediate concern in a 50-year-old might be completely normal for a 75-year-old. The prostate naturally enlarges with age, and PSA levels naturally rise. What doctors used to call abnormal PSA readings in seniors are often just normal aging. A major 2018 study found that men over 70 who underwent aggressive PSA screening were 3 times more likely to be overtreated for cancers that would never have harmed them. These treatments led to incontinence, erectile dysfunction, and serious infections from unnecessary biopsies. Meanwhile, the same study showed no improvement in life expectancy from this intensive screening. The real issue isn't finding cancer, it's what happens next. Men over 75 who are diagnosed with low-risk prostate cancer through PSA screening often receive radiation or surgery that reduces their quality of life without extending it. Recent research shows that for every 1 death prevented by PSA screening in men over 70, over 100 men suffer serious complications from unnecessary treatment. If you're over 70 with stable PSA levels and no symptoms, many experts now recommend stopping routine PSA testing altogether. Instead, focus the conversation with your doctor on your overall health, life expectancy, and what you'd actually do if cancer were found. For many healthy seniors, the anxiety and potential overtreatment from PSA testing outweigh any possible benefits. The key is understanding that aging isn't a disease, and slightly elevated PSA levels in seniors often reflect normal aging processes, not dangerous cancer. Number 4. Cholesterol levels. Here's where it gets controversial. Everything you think you know about cholesterol after 65 might be wrong. For decades, doctors have been aggressively treating high cholesterol in seniors the same way they treated in 40-year-olds. But mounting evidence suggests this approach is not only unnecessary, it could be dangerous. The shocking truth? Some studies show that seniors with higher cholesterol levels actually live longer than those with low cholesterol. This phenomenon, called the cholesterol paradox, has been observed in multiple studies of people over 75. A 2019 meta-analysis found that statin benefits decline significantly with age, and for primary prevention in healthy adults over 75, the evidence of benefit is extremely limited. The American Heart Association guidelines acknowledge this uncertainty. After age 75, they recommend a careful discussion of risks versus benefits before starting cholesterol medication. Yet, many seniors are still being prescribed high-dose statins based on cholesterol targets designed for younger adults. Here's what changes after 65. Your cholesterol numbers need to be interpreted differently because your cardiovascular risk factors change. A total cholesterol of 220 that would concern doctors in a 45-year-old might be perfectly acceptable, even protective in a 75-year-old. Recent research shows that older adults often respond more dramatically to lower-dose statins, meaning they can achieve the same cholesterol reduction with half the medication and fewer side effects. But the bigger question is whether aggressive cholesterol lowering is even necessary for most seniors. A 2019 study of over 47,000 veterans found that for men over 75 without existing heart disease, statin therapy provided no mortality benefit. Meanwhile, the side effects, including muscle pain, diabetes risk, and cognitive issues, became more common and more severe with age. Stanford research published in 2024 found that seniors need lower-intensity statins to achieve the same cholesterol reductions as younger patients. Yet, many are still prescribed the same high doses that work for people in their 50s. This leads to a higher risk of muscle problems, liver issues, and drug interactions, complications that can be devastating for older adults. The key insight: your body's cholesterol needs change with age. What's high cholesterol for a 50-year-old might be optimal for a 75-year-old. If you're over 75 and taking a high-dose statin with no history of heart attack or stroke, it's worth asking your doctor if the benefits still outweigh the risks. Number 3. Blood pressure readings. Blood pressure after 65 is perhaps the most misunderstood vital sign in senior care. The numbers that send doctors reaching for prescription pads might actually be protecting your brain and preventing falls. Here's why the blood pressure targets you've been told to hit could be wrong for your age. For years, medical dogma insisted that lower blood pressure was always better. But recent research reveals that this one-size-fits-all approach can be dangerous for seniors. A blood pressure reading of 140/90 that would trigger immediate medication in a younger adult might be optimal for someone over 70. Here's the critical difference. As we age, our blood vessels naturally stiffen. This isn't pathological. It's a normal adaptation that ensures adequate blood flow to vital organs, especially the brain. When doctors aggressively lower blood pressure in seniors using targets designed for younger adults, they risk creating hypotension that leads to dizziness, falls, and cognitive impairment. A landmark 2019 study found that seniors with systolic blood pressure between 130 to 140 had better cognitive function than those whose pressure was lowered below 120. The brain needs adequate pressure to maintain blood flow, especially when circulation becomes less efficient with age. Harvard Medical School research now suggests that for people over 65, blood pressure targets should be individualized rather than following universal guidelines. The American College of Cardiology acknowledges that the aggressive blood pressure targets used for younger adults may not be appropriate for all seniors, particularly those who are frail or have multiple health conditions. The real danger lies in overmedication. Seniors taking multiple blood pressure medications to hit targets designed for 50-year-olds often experience dangerous drops in pressure when standing, leading to falls and fractures. Studies show that each additional blood pressure medication increases fall risk by 8 to 15% in adults over 70. What's particularly concerning is that many seniors are experiencing symptoms of low blood pressure, fatigue, lightheadedness, confusion, but their doctors continue to increase medications because the numbers don't match young adult targets. This creates a cycle where treatments meant to prevent future problems create immediate dangers. The key is recognizing that optimal blood pressure for seniors isn't necessarily the same as for younger adults. A reading of 130/80 in a healthy 75-year-old might be ideal, even though it would be considered elevated in a 45-year-old. The focus should shift from hitting arbitrary numbers to optimizing function, preventing falls, and maintaining quality of life. But before we continue, if you have been enjoying the video so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Number 2, blood sugar and diabetes targets. This one might shock you. The blood sugar levels your doctor is trying to achieve could be putting you at serious risk. Diabetes overtreatment in seniors has become an epidemic, with up to 40% of older adults receiving unnecessarily aggressive treatment based on targets designed for much younger patients. Here's the disturbing reality. Tight blood sugar control that's life-saving for a 45-year-old diabetic can be deadly for someone over 75. The American Diabetes Association has completely revised its recommendations for seniors, yet many doctors are still using outdated targets that increase the risk of dangerous hypoglycemia. The new guidelines are revolutionary. Instead of the universal HbA1c target of less than 7% that applies to younger adults, the ADA now recommends individualized targets for seniors. For healthy seniors aged 65 to 75, the target may be 7.5%. For those over 75 or with multiple health conditions, targets of 8% or even 9% may be appropriate. Why this dramatic shift? Research has shown that aggressive blood sugar control in seniors doesn't prevent complications, it creates them. A 2025 study found that 19% to 40% of seniors with diabetes are being overtreated, meaning their blood sugar is being lowered to levels that provide no benefit while significantly increasing their risk of hypoglycemia. Hypoglycemia in seniors isn't just uncomfortable, it's life-threatening. Low blood sugar episodes can cause falls, heart attacks, strokes, and cognitive impairment. Seniors are especially vulnerable because aging blunts the body's warning systems for low blood sugar. By the time symptoms appear, blood sugar may already be dangerously low. Kaiser Permanente made this exact change in 2016, relaxing HbA1c targets to less than 7.5% for patients 65 to 75 and less than 8% for those over 75. The results? A 28% reduction in medication changes and fewer emergency room visits for hypoglycemia, with no increase in diabetes complications. What makes this particularly troubling is that many of these overtreated seniors are experiencing frequent low blood sugar episodes that are dismissed as normal aging. Confusion, fatigue, unsteadiness, and memory problems in diabetic seniors are often signs of overtreatment, not undertreatment. The American Geriatric Society is even more explicit in its recommendations. They state that overtreatment of diabetes is common in older adults and should be avoided. For seniors with complex medical conditions, they recommend focusing on preventing symptoms of high blood sugar rather than achieving aggressive numerical targets. A 2022 clinical trial showed that seniors with HbA1c levels between 7.5% and 8.5% had better outcomes than those with levels below 7%. They had fewer hospital admissions, better cognitive function, and improved quality of life. Yet many are still being pushed toward the lower targets that benefit younger patients. The key insight: your diabetes treatment needs should decrease, not increase with age. If you're over 70 and experiencing frequent low blood sugar episodes, dizziness, or falls, you might be overtreated. The goal should shift from preventing long-term complications to maintaining daily function and preventing hypoglycemia. Number 1. Hemoglobin and anemia diagnosis. This is the blood test result that's being misinterpreted most dangerously in seniors. What doctors are calling anemia and treating aggressively might actually be normal for your age. And this misdiagnosis is leading to unnecessary treatments that can harm more than they help. Here's what most doctors don't know. Normal hemoglobin levels naturally decline with age. The anemia cutoffs used in hospitals and clinics were established decades ago based on young, healthy adults. Using these same ranges for seniors leads to massive overdiagnosis of anemia and unnecessary treatments that can be dangerous. Recent research shows that what we call anemia in a 75-year-old would be completely normal hemoglobin levels for that person's age. A hemoglobin level of 11.5 that would trigger concern and treatment in a younger adult might be optimal for someone over 70. Yet seniors are routinely subjected to invasive testing, iron supplementation, and even blood transfusions based on these inappropriate standards. The consequences are serious. Iron supplementation in seniors without true iron deficiency can cause constipation, nausea, and dangerous interactions with other medications. More concerning, it can mask the symptoms of serious underlying conditions while creating new problems. Iron overload in elderly patients can contribute to heart problems, liver damage, and increased infection risk. A 2019 study found that up to 20% of seniors are misdiagnosed with anemia using standard reference ranges. When age-appropriate ranges were applied, most of these diagnoses disappeared. These patients had been subjected to months of unnecessary iron supplements, expensive testing, and anxiety about a condition they didn't have. What makes this particularly problematic is that mild decreases in hemoglobin with age may actually be protective. Some research suggests that slightly lower hemoglobin levels in seniors are associated with better outcomes, possibly because the blood becomes less viscous and flows more easily through aging blood vessels. The real issue is that doctors are using one-size-fits-all reference ranges for a population where normal physiology changes significantly with age. A hemoglobin level that would be concerning in a 40-year-old might represent healthy aging in a 75-year-old. Even more troubling, many seniors are being given blood transfusions based on hemoglobin levels that wouldn't require intervention if age-appropriate standards were used. Blood transfusions in elderly patients carry significant risks, including infections, fluid overload, and immune reactions that can be life-threatening. The European Society of Cardiology now recommends different hemoglobin targets for seniors, acknowledging that age-specific ranges are needed. Yet, most hospitals and clinics continue using universal standards that lead to overtreatment. Here's what you need to know. If you're over 70 and diagnosed with mild anemia based solely on a blood test, ask your doctor if symptoms are present. True anemia causes fatigue, shortness of breath, and weakness. If you feel fine and your hemoglobin is slightly below the standard range, you might be experiencing normal aging, not disease. The key is understanding that your blood, like the rest of your body, changes with age. What's normal for a 30-year-old isn't necessarily normal for a 75-year-old. Age-appropriate interpretation of blood tests could prevent thousands of seniors from receiving unnecessary and potentially harmful treatments. So there you have it, 5 blood test results that are being dangerously misinterpreted in seniors, leading to overtreatment that often causes more harm than good. The medical system is slowly catching up to the reality that aging bodies need age-appropriate care, not one-size-fits-all treatments designed for younger adults. The bottom line, your blood test results after 65 should be interpreted differently than they were when you were 45. Numbers that would have concerned doctors decades ago might be perfectly normal for your age, and aggressive treatments based on outdated targets could be creating more problems than they solve. Remember, aging isn't a disease that needs to be cured. It's a natural process that requires wisdom and individualized care. Your doctor should be asking not just, what do the numbers show? But, what do these numbers mean for this particular senior? Which of these blood test revelations surprised you most? Have you experienced overtreatment based on blood results that might be normal for your age? Let us know in the comments. We're reading and replying to every single one. And if you want more senior-focused health information that challenges conventional wisdom with real science, make sure to subscribe and turn on notifications. Your health decisions after 65 deserve better than outdated guidelines designed for people half your age. If you have any questions about discussing these findings with your doctor, feel free to leave a comment below. Remember, knowledge is power, especially when it comes to advocating for appropriate, age-conscious medical care. Thanks for watching, and here's to smarter, safer healthcare after 65.